All right. And my name is Scott Smith, and I'll be the facilitator here tonight on Zoom. We want to make you aware that you are able to interact. And so we're super excited that you're here tonight. We've got a lot going on that you're going to learn tonight that I believe is going to help you. We're going to talk about the damaging effects of stress on the brain. And we welcome tonight Dr. Evan Mladenoff. So I want to make you aware as we get started, just a few housekeeping things as a few more people come on in. Number one, first of all, there is a Q&A box. Feel free to ask your questions there. We'll also be monitoring the chat box. So if you click chat, you can do like Bridget and Jody and Brenda have done. We were just talking about our favorite drinks and what we're having right now. Jasmine green tea, for instance, Bridget is having here tonight. So we're about to just settle in and get our wagons loaded on some really life-changing truth. One of the things I like about this subject, and I'm looking forward to this tonight, is not only is every single one of us affected by stress, but also we know people that are. We have spouses, we have children, we know people in our lives, especially through the pandemic, that have been affected by stress. So the information that you're going to get tonight is useful to you, but it's also useful to those that you care about. So you're going to have some nuggets, I believe, that you're going to be able to give to others, as well as use in your own life and for your own health and well-being. So with no further ado, we want to welcome Dr. Evan Mladenoff of Mladenoff Clinics, Dr. M, as he's affectionately known. We missed Dr. Chip tonight, but he's attending virtually. We're glad to hear from you, and I know you've got a lot to say, so the floor is yours, sir.
Thank you very much. Okay, let's just pull up my slides here. Okay, has that got us going live now?
Yep, 100% looks great.
Okay, perfect. Okay, so I'd like to welcome everybody here, and I want to first of all thank everybody for coming. And like we have started in the past, you know, our intention is going to shape where we're going to go and the outcomes that will happen. And so I like always reading this before I give a presentation to myself and to the attendees. So if you allow me the grace, God bestows more consideration on the purity, on the intent of the intention with which our actions are performed than on the actions themselves. So I want to thank everybody for their kind words, because dreams and blessings and prayers come true. So about 5 weeks ago, Dr. Chip and Christina had their baby, little baby Evan, as on the left-hand side. That was about 5 minutes after the baby was born. You see how alert the baby eyes are and everything. And of course, now Dr. Chip is on sleep duty. So one of the things we're going to talk about, stress management, is sleep. And so Dr. Chip acutely now understands why dad and mom take a nap at 20 minutes at lunchtime, because that's probably the most he sleeps now when he goes home. So Dr. Chip's on dad duty tonight. And I have the triple blessing of having little baby Evan. So he's Evan Philip Mladenoff III. And so everybody says, well, what are you going to call him? And Christina says, well, everybody calls you Doc or Dr. M, and everybody calls my husband Chip or Dr. Chip. One of you guys has got to go by your real name, so we're calling him Evan. So he's not going to have any nicknames. He's just going to be Evan. So that's really a blessing. The innocence of a child looking into your eyes just makes all the troubles in life go away. So I want to thank everybody for their well wishes. After we send out an announcement that the baby was born and healthy, and mom and dad are doing great too. All right, so now the purpose of the webinar. We want to tell you how your stress system works. We want to show you the damages that can happen specifically to your brain. How do you decrease, repair, and strengthen your stress system? How do you prevent, protect, and strengthen your brain, most importantly? So I don't want you taking notes, because we're going to go really quick and a lot of stuff. But if you just take your cell phone and type the word stressed brain, all one word, to 22454, we're going to send you a link of a page with all the documentation, with all the links of all the articles we're going to talk about, so you can get it all in one place. So stressed brain, all one word, to 22454. All right, so I want to review real quick, because we did a couple of webinars last year that were really important about how do you strengthen and repair and build your immune system. So several things can happen. And so a couple of things that we're really excited about is, number one, if you were with us before Christmas, Sandy was able to get us a deal on these mini air purifiers that actually kill viruses and bacteria. And they're having another special. The regular price is $189. If you're interested, at $149, just give Sandy a call and tell her, okay, you want one. We have one in the major rooms we live in, like the library where I'm recording this now. We have one in the kitchen, one in the bedroom, and one in our TV room. The bigger units will control a big space, but we really don't have a big space. We have small, chunky little rooms in our house. So if you're interested, tell Sandy, just tell her how many you're interested in, she'll reserve them for you. And when we get them, you need to have these things. Something else that we've been able to get a hold of is zinc. We have a new zinc product in the office that is double strength. So I know a lot of you did the zinc taste test when you came into the clinic. If you have not done the zinc taste test, come by the clinic. It takes 2 minutes to do the test. We drop a clear liquid in your mouth, and then whether you taste it or not taste it or how much you taste it tells us how your body's doing with zinc. So the right amount of zinc will help lower respiratory infections and will help decrease the incidence of infections, especially in elderly. It helps the morbidity of lower respiratory tract infections. So this is one of the things that happens with COVID. In any viral infection of the lungs, it can become life-threatening. So zinc actually helps decrease that. And then also zinc reduces the duration and severity of just a common cold, but you got to start it within 24 hours. So we've got a new double strength zinc that works really well. And then so here's a little information that we're going to send you all this information of the other things that zinc does as well. And then the other thing is vitamin D3 is really important to your immune system, but it's also important to many other things. We're going to send you this information. We've got this liquid vitamin D, a liposomal D3, where you can literally put it on your skin. And the cool part is Dr. Chip and Christina are already putting D3 on little baby Evan's skin, and he's getting his right amount of D3 because he can't go outside and there's not too much sun outside now anyway. But just topically, you don't have to put it in his mouth, don't have to worry about taste. So this product is great for kids. Okay, so now let's go on to our topic of the night: traumatic effects of chronic stress, damage your brain, and what you can do about it. So Hans Selye, the father of stress, started stress in the 1950s, and he defined stress as a condition or feeling experienced when a person perceives that demands exceed the personal and social resources the individual is able to mobilize. And being the pioneer, he said, stress is not necessarily something bad. It all depends on how you take it. The stress of exhilarating, creative, successful work is beneficial, while that of failure, humiliation, or infection can be detrimental. And so he gave multiple causes, as you can see on this chart. We're going to send you this chart, ranging from chemicals, which could be drugs or pollutants. There can be emotional causes: anger, fear, guilt, loneliness, especially loneliness after this past year. There can be mental stress, anxiety. I like the term, it's not long work hours. You now live at work. Those people that have had to work at home, you live at work, so you never escape work. There can be nutritional problems that develop that create problems with your stress system, like allergies, vitamin and mineral deficiencies. Your physical activity, it will determine the state of your health. Lack of sleep, as Dr. Chip and Christina have found out acutely with a new baby. You gotta catch up whenever you can. And sometimes that just means closing your eyes for 20 minutes. The psycho-spiritual, part of the stress system. There can be financial or career pressures. That can be spiritual misalignment. In other words, if you're not spiritually aligned with the Creator, you could be creating problems for yourself. You're not taking advantage of what tools you have in the spiritual realm of the Creator. And then, of course, then there can be trauma. We did one seminar on the childhood trauma. We talked about the ACE study. There can be physical injuries, there can be PTSD, there can be surgery, there can be terrorism, all kinds of traumatic things that can happen. So here in 1956, here's what Hans Selye found. 48% of people said that stress has a negative effect on their personal and professional life. 54% said stress caused them to fight with people close to them. And 26% reported being alienated from a friend or family member because of stress. 1956. So just keep that in the back of your mind as we go through a couple other quick stats. All right, so now let's look at how our amazing brain works. So first of all, there's 100 billion neurons. Okay, a neuron is the smallest fiber of the brain and how it works for processing information. Our brain weighs about 3 pounds, and the electrical impulses on those neurons go up to 268 miles per hour. That's pretty quick. We have 65,000 thoughts every day. Now, a lot of times these thoughts are random recurring thoughts, and they say, psychologists say about 50,000 of these thoughts are absolutely unnecessary. It's like, oh, wait a minute, the door just closed. Oh, the tap went on, Sandy must be doing the dishes. Oh, she turned on the TV. It's like, random thoughts like that have nothing to do with day-to-day life, but we just think about those things. And if you can't shut off those things, they keep accumulating. Our brain uses 10 to 23 watts. So when you wake up, it'll generate electricity and it could light a whole light bulb. 25% of our oxygen, as you're sitting here right now, your brain uses 25% of your oxygen. Our brain is 2% of our body weight and 75% of our brain is water. So now you have some of the answers of what you have to do to take care of your brain. It's 2% of your body weight, but it needs 25% of the amount of oxygen you have in your body. So should you do something to help improve the oxygen delivery to your brain? And the answer is heck yes. Should you have enough water intake? If 75% of your brain is water and you don't drink enough water, what's going to happen to your brain? It's going to shrink. So the energy consumption, your brain uses 20% of the total energy of your body. So if you're putting the wrong fuel into your body, the wrong food into your body, then the energy to the brain is going to get messed up. So you got to put the right fuel into your body so that your brain can use it. Again, 2% of your body weight, 25% of the oxygen, 20% of the energy consumption. Your brain is more active when you fall asleep. That's because it's processing and trying to deal with stuff that happened during the day. You're trying to get rid of stuff and process stuff. There are several different parts of the brain, and depending on which part of the brain is effective, you get different symptoms. So for example, in the light blue area, that's your temporal lobe. That's responsible for behavior, hearing, and speech. So if that part of your brain is affected, then your behavior might change, your speech may change, your ability to hear might change. If the yellow part, the brain stem, is affected, then you could have blood pressure problems. Your heart rate could be going on too fast or too slow or up and down all over the place. You may have trouble breathing or swallowing. The purplish red part, the cerebellum, you could have balance problems. So depending on which part of the brain is affected, that's where the symptoms are going to be manifested. Then, of course, you've heard of the right and left hemispheres of the brain. The left hemisphere is a logical, rational, calculating, mathematical part. The male part, the right side, is the creative, lyrical, musical, feminine side of your brain. And so those two should be working in symphony and coordinated with each other. And so you see some people are more dominant in one than in the other. We have neural connections. The first thing is your brain does not have any pain receptors. So your brain itself cannot feel pain. So a headache involves muscles and nerves in your head and the neural connections that happen there. The other thing is that oxytocin, the brain chemical, which makes you feel love, is very powerful. And so oxytocin and serotonin, they can drive you to do crazy stuff because those hormone releases can become addictive, and you'll do things to make those hormones become released. And then finally, you got to eat the right food. So there's certain foods that will help your brain, certain foods that are uncommitted friends, and certain foods that are just flat out bad for your brain. So we're going to cover some of these things, but I wanted to just give you this quick background. We're going to send you this one-page diagram that is a pretty nice synopsis of the whole functioning of the brain. All right, so now this was released recently by the National Institute of Mental Health. And what they did was they did a comparison of, okay, COVID-19, here's what happens. And there can be, I'm going to just move something here. Sorry, I'm going to go. There we go. COVID-19, you could have symptoms of fever, dry cough, trouble breathing, extreme fatigue. Anxiety, you could have panic attacks, and there could be discrete episodes that stop and start, where you can have rapid heart rate, feeling of impending doom. You can have feeling of, your chest is being restricted. You could have abdominal cramping. And then there's an overlap of symptoms in that orange area where it could be problems with anxiety in your stress system, or it could be you've got a COVID or a viral infection where you have chills, shaking, sweating, chest pains, hot flashes, and shortness of breath. So there's some overlap in these, but there's also some distinct symptoms that you can have on either side. Okay, so now just how does chronic stress damage your brain? So we're going to go through a few things. I've written an article that we've posted. We're going to send you all this information. Okay. So the first thing is that stress in America in 2020, this was an article that's published annually by the American Psychological Association. And so they did this study that was just recently published, categorizing what happened last year. And so here's what they found. The COVID-19 was a significant stressor in 8 out of 10 Americans, and 7 out of 10 Americans say they have experienced increased stress over the course of the pandemic. That's a lot of people. In Generation Z adults, 20% say their mental health is worse than it was a year ago. Now, this is 2020. This is not even 2021. So this data is almost a year old in a lot of these statistics now. A disruption of education causing stress to college students. 87% said education is a significant source of stress. 82% said they were uncertain about the 2021 year. What do you think the stats are going to say for this year about how much stress there was? 82% is pretty high. It's, I'm sure it's going to go like over 300%. No pun intended. 67% said that planning for the future was very difficult because of the pandemic. And then here we see these two lines going from 2018 to 2020, the amount of increase in stress. So you see those Gen Z college age adults have dramatically more increase in stress than non-college adults. Okay, the percent of adults agreeing that the pandemic made 2019-2020 school year extremely stressful for them, 63%. And you can see the breakdown on the right-hand side by the ages. This was another article. This was published in just 2 weeks ago, March 2nd, 2021. Now, this is a study on pediatric mental health. This is an accumulation of all the healthcare claims from major insurance companies of where did these patients go and what was wrong with them. So when I was loading these things up, I was really concerned because I thought I was making a mistake. So here we have mental health claims, is the green bar graphs, and the blue bar graphs you see that are all going down. There was, from all the medical claims, there was a dramatic increase in the mental health claims. And these are 13 to 18-year-olds. And then this was that 13 to 18-year-old group. Okay, females in the pink, boys in the blue. Boys on average, 30% increase in mental health claims, 65% on average in females. Now, this looks like that first graph that I showed you 2 slides ago, but this is for the 19 to 22-year-olds. So they are experiencing the same results. Again, the mental health claims are in green. The blue ones are all medical claims, dramatic increase in mental health claims. The same stats, pink ladies, blue boys, age 19 to 22, 35% on average for boys, month by month, 60 to 65% increase in mental health claims by girls in that same 11-month period. Now, here's an interesting one: intentional self-harm. People trying to harm themselves. And they just said self-harm. They didn't say because of pain, because of taking addictive drugs, or were they trying to commit suicide, or what exactly were they trying to do? But again, just look at the green versus mental health problems, intentional self-harm. Blue is just the year before, 13 to 18-year-olds. Okay, females more affected than males, intentional self-harm. This is the 13 to 18 age group. Are you paying attention to what your children or your grandchildren are doing? This is the 19 to 22-year-olds, and you see the same things. The green is the increased number of intentional harm in 2020 versus 2019. Here is males versus females, that 19 to 22 group of intentional self-harm. Now, this is an interesting one. This is by region in the country, and it shows self-harm claims in the 13 to 18 group. And you see there was no part of the country that was not affected. Every part of the country was affected. And then here we have substance abuse and overdoses, 13 to 18-year-olds. Now, they didn't say what the overdose was. Was it overdose drugs, overdose alcohol, overdose opioids, CBD? It did not say what the overdose was. They just went to ER because of overdose problems. And again, green is substance abuse and blue is overdose. Here we have 19 to 22-year-olds, same thing, not as much towards the end of the year, but certainly in the summertime, there was increases. Here we have attention deficit hyperactivity disorders and obsessive compulsive disorders, 6 to 12-year-old group. And you see the huge increases in obsessive compulsive disorders, tic disorders. Here we see the same thing for 13 to 18-year-olds, huge increases in generalized anxiety, major depressive disorders, adjustment disorders. Here we see the 19 to 22-year-olds, generalized anxiety way up, way up. Major depressive orders, adjustment disorders. Our children are having trouble dealing with all of these issues that are being made of them. So now this is one of my favorite ones. This is emergency room visits for age 13 to 18-year-olds. So you see the red ones are dramatically increased from June to November. Okay, that's mental health conditions. But look at the orange ones. The orange bars decreased in every single month after February, which is head injuries. Why did head injuries, ER visits go down? The kids weren't doing anything. They weren't playing any sports. They were staying at home. They were isolated and they weren't doing anything. So this one slide right here encapsulates, what's happening. The blue, which is decreased trips to the emergency room, general signs and symptoms, was even greater than the head trauma. But again, the red indicating mental health conditions dramatically increased. Here we have major depressive disorders and generalized anxiety disorders, 13 to 18-year-olds. So the blue is depressive disorders, green is general anxiety. These are huge numbers, 20%, 30%, 15%. Emergency room visits for the 19 to 22-year-olds, panic disorders. So an increase of panic disorders when school was supposed to start in September, August, didn't start. Panic starts setting in, especially athletes who could be trying for a college scholarship and that whole arena of, if you pardon the pun, panic. They're panicked about the panic of not being able to play to try and get a college scholarship. And so finally, this map right here shows you the intentional self-harm claims made across the entire country for 6 to 22-year-olds by state for 20 to 20. So the red ones are the worst ones. The green ones are the best ones. So if you have a look over there, New York State is kind of like greeny yellow, and Kansas and Missouri are kind of orange. So where would you rather be? And the answer is, well, heck not New York with all the pandemic things going on there. But you see Kansas and Missouri, even though we are a protected community, so to speak, away from all the transportation that comes in and out of the country because of major airports, we still have higher intentional self-harm in our children than places like New York and California and Florida do. So the Midwest is not immune to problems of stress and mental health problems. Okay, so now let's look at exactly what happens to our brain when we do this. Okay, sorry. There we go. Okay, so now stress makes you forgetful and emotional. Now, I'm going to just read a couple of these things here. So memory problems may be one of the first signs of chronic stress that you'll notice. Misplaced items, missed appointments, can have you scrambling, further adding to your stress. And we tend to blow this off. Oh, I just forgot where my keys are. Or, oh, I just forgot my granddaughter's name. How could you forget your grandson's name, your first grandson's name? So cortisol can kill, shrink, and stop the generation of new neurons in the portion of the brain that's responsible for storing memories. So do you think this area is affected in patients with dementia and Alzheimer's? So most people find that all this stress also makes you more emotional. When you're stressed, electrical signals in the brain associated with factual memories get weaker, and while the signals in the areas of the brain associated with emotions get stronger. So your memories decrease, your emotions increase. And those of you that have had family members with any amount of the dementia, Alzheimer's spectrum, as I've had, my mother and her sister, they get angry when they get emotional. And when they can't remember, you can see on their face when you come face to face with them, they somewhere deep inside, they know who you are, but they can't remember. And then they get angry because you've disturbed their stable datum, their normal comfort zone. And so if you experience that, that is very disheartening when you see that in family members. The next thing that can happen is that stress creates a vicious cycle of fear and anxiety. So chronic stress actually fortifies an area of your brain called the amygdala. This is your brain's fear center. So stress makes your fear center stronger. Stress increases the size, activity level, and number of neural connections in this part of your brain, and it makes you more fearful, causing a vicious cycle of more fear and more stress. Does this sound like anybody you know? Stress halts the production of new brain cells. So every day you lose brain cells, but you also have the opportunity to create new ones every day. So a substance called brain-derived neurotrophic factor, we're going to talk about that when we talk about what you can do to fix your brain. Okay, so brain-derived neurotrophic factor, or BDNF for short, is a protein that's integral to keeping existing brain cells healthy and stimulating new brain cell formation. So it's often been called fertilizer for the brain. So this brain-derived neurotrophic factor can offset the negative effects of long-term stress in your brain. But cortisol stops the production of this wonderful hormone that results in the formation of fewer new brain cells. So lowered levels of that BDNF are associated with brain-related conditions like depression, obsessive compulsive disorder, schizophrenia, dementia, and Alzheimer's disease. Stress depletes critical neurotransmitters. So your brain communicates via proteins or chemicals called neurotransmitters. I like to call them the hormones of our brain. Constant stress reduces the levels of these critical hormones, especially serotonin and dopamine. So low levels of either of these transmitters can leave you depressed and more prone to addiction. So serotonin is called the happy hormone and plays a large role in mood, learning, appetite control, and sleep. Women, especially low in serotonin, are prone to depression, anxiety, and binge eating. Men, on the other hand, are more prone to alcoholism, ADHD, and impulse control disorders. Dopamine is the motivation molecule. It is in charge of your pleasure reward system. Too little dopamine can leave you unfocused, unmotivated, lethargic, and depressed. And people low in this brain chemical often use caffeine, sugar, alcohol, illicit drugs to temporarily boost their dopamine levels. Not sure if your depression is related to serotonin or dopamine. There's a good chance it is. Serotonin-based depression is characterized by anxiety, irritability, while dopamine-based depression manifests as lethargy and lack of enjoyment of life. Does that sound like anybody you know? Stress puts you at greater risk for mental illness of all kinds. There are physical differences in the brains of people with stress disorders, so chronic stress puts you at increased risk for developing a variety of mental illnesses, including anxiety, panic disorders, depression, PTSD, schizophrenia, bipolar disorder, drug addiction, and alcoholism. And we all know this one. Stress flat out makes you stupid. We've all seen this in athletic events where the quarterback drops back to throw a pass. It's late in the game. He's got to drive down the field to score a touchdown to win or tie the game. And they're getting down to the 10, 20-yard line. Quarterback drops back, throws a pass, throws it to a guy on the other team with none of his guys within 5 feet of him. How can that happen? And the answer is high stress at that time of the game. If the quarterback cannot manage all the emotions, all the physical stuff that's going on, he does stupid stuff. All right. So stress can make your brain seize up at the worst possible times. So we're going to talk a little bit about when we talked about the trauma cycle. Remember, the stress reaction is the first thing you become immobilized. You go, and you freeze. And then the second thing is your conscious mind takes over. Then you're going to fight or flight. So the reason why stress makes you stupid, you become immobilized. You go, and it usually happens at the worst possible time. So it's a survival mechanism. If you're faced with life and death situation, instinct and subconscious impulse overwhelm our rational thought and reasoning. And so this can keep you from being killed when a tiger comes up against you. Okay. But in modern life, this immobilization is rarely helpful. So persistent stress impairs your memory and makes you bad at making decisions. If you're always stuck in, you can't decide a thing. It negatively impacts virtually every cognitive skill you can rely on to get through the day, including your ability to pay attention, remember, solve problems, make decisions, and think critically. Excuse me. Am I going too fast? Okay.
I don't think so. You're doing great.
Okay, thank you. Well, sometimes I feel like I'm getting revved up. I get so excited talking about this, as patients know. It's like sometimes they need a muzzle. So just want to make sure, and that's why we like to send you that link, because as I'm blowing by this stuff, there's a lot to think about all these things. Okay, so
you're getting a lot of love in the comments, and I'll say that's the great safety net is the recording. It's like drinking from a fire hose, but the visuals really help. So
well, the problem is I got 2 high fire hoses aimed at them with a third.
No, great stuff. This is awesome.
Well, and the beauty of this is, like, a lot of times we don't have time in the office when patients come in, because we need to deal with their immediate problems right now, or their long-term problems, or whatever they need attention to. And so we can't give them a lot of the background of things of why we do. So this is totally awesome. Okay, so here's one of my favorites. Stress shrinks your brain. It literally makes your brain smaller. So if you go online and search all the stuff in the NFL and the CTE, chronic traumatic encephalopathy, you'll see the brains of those athletes, or boxers especially. Those brains are dramatically smaller than a regular sized brain in a 45-year-old. So chronic stress can measurably shrink your brain. Cortisol can kill, shrink, and stop the generation of these new neurons, like we talked about. And those neurons are where memories are stored. So not only does your brain shrink, but your memories and your ability to recall memories goes away. The hippocampus, part of the internal part of the brain, is critical for learning, memory, and emotional regulation, as well as shutting off the stress response after a stressful event. So here's what should happen when you're under stress. You get stress coming and you go, and then you're going to decide to fight, or you're going to say, I think I'm going to just turn and run a little bit. After the stressful event is resolved, then you go, oh gosh, that was close. I hope that never happens again. And then you kind of rest and rejuvenate, right? So the hippocampus is the part that's responsible for the rest and rejuvenate. And then so you can start to repair and shut off the incoming stress. But if you never shut off the incoming stress, guess what? You're going to burn out that hippocampus, and you're never going to be able to go, oh gosh, I can just calm down now. There are some people, I know people like this. This may be some of you on the line. It's like you just never stop. It's like you got, the motor's running all the time, and you can never turn off the motor. Well, that's the secret of managing your stress in your brain. It's like, okay, controlling that internal motor, right? Okay, so constant stress also shrinks the prefrontal, the front part of your brain. This is what separates us from the rest of the animal species, is our frontal cortex, which allows us to make decisions. Our working memory allows us to control impulses, allows us to communicate with voice and verbal commands and respond to all those things. It allows us to evaluate people by just looking at their face and telling who they are if they aren't wearing a chin diaper, as they call them, right? Oh, sorry, that's a mask. I call them a chin diaper. But it's like, wouldn't it be nice to just see people and just see their expression, instead of wondering, is that person smiling, or is he mad at me, or is like, what's going on, because they're wearing these chin diapers. So stress can shrink your brain. Okay, so stress can also let toxins into your brain. So here's if you ever watch Star Trek, I like using this analogy. Is Star Trek, they talk about the force field around the ship, right? And they say force fields are down 78%, Captain, right? And so our brain has this physical barrier called the blood-brain barrier. And the purpose of the blood-brain barrier is to keep the environment of the brain sterile. There's certain things that should never get into your brain, like viruses and bacteria and toxins, okay? And there are other things like magnesium and zinc that should get into your brain. And then there are other things that blow open the blood-brain barrier and make it like Swiss cheese would be a good example, right? It doesn't have to be that big, like a sifter, right? So cortisol takes that blood-brain barrier and turns it into a sifter. So now stuff that's not supposed to be in your brain will get into your brain, right? So chronic stress, the cortisol weakens that blood-brain barrier, makes it more permeable. It literally puts holes in it and allows stuff to get into the sterile environment of the brain that aren't supposed to be there. Some of you who I know who have kids that have gluten sensitivities, or some even high performance athletes that have celiac problems, you've heard of the gut brain connection, where what happens in your gut, if you absorb these glutens and they cannot be digested and metabolized properly, they got to go someplace. So if the blood brain barrier is open, they go to your brain, and all of a sudden you start having memory problems, brain fog, allergies, anger issues, all kinds of craziness can happen because that protective barrier in the brain has been compromised. And toxins is probably the wrong word. The stuff that can get into your brain that's not supposed to get into your brain gets in there. So that doesn't mean it's a poison. Stuff that's not supposed to be in the brain is not supposed to be in the brain. And we have a mechanism that we have to use to protect that. So sometimes when we're dealing with stress issues, certainly with head trauma things, we have to repair that blood-brain barrier. We have to get rid of the holes in that membrane so that the force field around the ship, so to speak, the force field around the brain will be strong and protect us. Okay, so stress can increase the risk of dementia and Alzheimer's disease. There's a lengthy stuff that is in this section. I'll let you read that, but I want to just quote you 3 things. 1 in 3 U.S. seniors will die of Alzheimer's disease or other forms of dementia present in the next decade. 1 in 3 seniors. What's a senior? Over 65. 1 in 3 people. That's a lot of people. The drug industries have spent billions and billions of dollars to try and come up with a drug for Alzheimer's, and they have all failed. There's at least 30 drug trials that have failed. So now you're going to start hearing the term type 3 diabetes, which is the brain is getting too much sugar, and so it's literally causing cells to shrink. And so that's the deal that the drug companies are trying to work on, a type 3 diabetes drug, and none of them have worked. But they're spending billions of dollars to try and first one to come out with this drug is going to cash in, but there's no magic bullet for Alzheimer's. The common sense advice is, okay, you got to take care of yourself starting when you're younger. Okay, so now here is one of those dirty secrets. Every person with dementia and Alzheimer's has elevated cortisol. If you read the literature, it says cortisol is a result of Alzheimer's and dementia. And there's nothing further from the truth. The elevated cortisol causes dementia and Alzheimer's. So, which came first, the chicken or the egg? And the answer is the stress races you down the path of dementia, races you down the path of Alzheimer's. And so every Alzheimer's patient, every dementia patient, of which there are 4 stages, has elevated cortisol. What's the secret? You need to make sure you modulate your cortisol starting when you're age 10. Not when you're age 65 and your brain's already started to shrink. So prolonged anxiety, prolonged stress, prolonged mood stuff, prolonged abnormal food intake, prolonged addictive behavior like alcohol to try and deal with this pandemic, loneliness, or stress. All those things are going to drive you towards dementia and Alzheimer's faster. Okay, so stress causes our brain cells to commit suicide. So there's a word, one of my favorite words is called apoptosis, spelled APOPTOSIS. And so here's what this means. This is programmed death that happens. So our genetic code has this capability of protecting our brain. So if something goes wrong in the brain and those nerve cells are starting to not work properly, like a light switch is going on, a genetic trigger goes on to kill those brain cells, because the abnormally functioning brain cells can cause more problems than a dead brain cell. So the genetic code to kill that brain cell is called apoptosis. Now here's the problem. Just when you turn on the light switch, you can never turn it off. So the only thing you can do is control the amount of light that's going through it. So I know you've got the chandelier in your dining room, and so sometimes you like to put the light down a little bit so you get the nice mood for dinner and everything. So let's say you finish your party, middle of the night, you say, you know what, I think I left the stove on. I better go downstairs and check. So you go downstairs. Oh, good. Stove's not on. But then you have a peek in the dining room and there's still a little bit of light coming through the chandelier. And you say, well, geez, I thought I turned that light off. Right. So what does that have to do with programmed cell death and your genetics? Okay. So that dimmer switch. So when you turn on the dimmer switch and you just click it, okay, and there's minimal electricity going on, it's still dark in the room, right? Not too much in the light bulbs. But when you slide up the slider, you can control the amount of light that comes through those light bulbs. Well, when you trigger that apoptosis gene, that programmed cell death that causes the cells to commit suicide, you can control how fast or how slow that goes, but you can never turn that switch off. Once it's been flipped, that's it. Your brain cells have a genetic code to commit suicide. The question is how fast and how many of them, okay? Stress causes that to happen. So stress also contributes to brain inflammation and depression. So if you've been in the office, even for 3 heartbeats, you've heard Dr. Chip and I and Sandy talk about inflammation. And inflammation is a number one problem that affects many, many parts of the body. So our brain has its own immune system that protects us from certain things happening. And one of the things that happens is chronic stress will cause the cells of this immune system in the brain. So these cells are called microglia. Okay. These microglia release chemicals called cytokines. Okay. So when the microglia get triggered and turned on, okay, they make cytokines. Now, remember, we talked about this and you've heard about this with this COVID stuff. Who gets worse? Who are the patients that are at high risk of dying? Those patients that go into a cytokine storm. Remember hearing that cytokine storm? So we're going to send you the reference. We talked about that in one of our webinars about the immune system. But the point is that once these microglia, these brain cells that control the immune system of the brain get triggered to ramp up inflammation, guess what? It's a blowtorch on your brain now. So now you're going to get anxiety, memory loss, trouble concentrating. You may have brain fog. You may have mental disorders that go all the way to just not being able to remember, to schizophrenia, Parkinson's, and Alzheimer's. So inflammation is a blowtorch on the brain. So one of the things that we like doing is our anti-inflammatory diet. I know a lot of you have followed that. So again, we're going to send you a link where you just come on by. If you don't have a copy of the book, Dr. Chip, Dr. Diana, and I wrote on Take Aim on Your Health. So the anti-inflammatory manual, we've got a lot of great suggestions in there. So stress will contribute to brain inflammation and depression. Okay, then our last one here is that stress creates free radicals that kill brain cells. Now, free radicals are these weird group of chemicals that are not supposed to be in the body, and they cause things to happen. So they have free radicals, meaning an oxygen molecule is unattached and goes where it's not supposed to go. They attack brain cells in much the same way as oxygen can attack metal and cause metal to rust. Right? So you've all seen that. So these free radicals actually punch holes in the brain cell walls, and cause them to rupture and die. So some of these things are short term is a ROS, or a reactive oxygen species, or there's a nitrogen reactive oxygen species. So several different classifications of these drugs, but basically these hormones rather, if you don't have enough glutamate enzymes, and they are initiated and created from a substance called N-acetylcysteine, then inflammation starts to happen and you get holes punched in your brain, right? So inflammation will cause triggering of these reactive oxygen species, just like oxygen causes rust to metal, metal to rust, sorry. I think Dr. M needs some eye stress studies. He's got a little wound up here. Okay. So now, Carolyn Meese, if you've ever heard of or read of any of her books, she wrote a wonderful series of books called Energy Medicine. It's a long dissertation, but her premise is that intention without action is useless. And so the reverse is also true. The wrong action for the right intention can create problems. So here's one of my favorite ones. After the 100-day war, where the Israelis defeated the Arabs, the male society decided, okay, we're never going to take up arms again. And so if you know anything about the chakras or the chakras, they're referred to many different ways, but we have 7 energy vortices in the body. The first chakra is around it's called many things, the tribal chakra, the sacral chakra, the base chakra. Okay, so Carolyn describes it as the tribal chakra. We all want to belong to a group, and the group has certain unwritten rules that cause you how to do things. Also, otherwise you'll be ostracized from the group. So you see this all the time where everybody starts wearing their KU shirts and their Mizzou shirts, or in the case of Dr. Am, he'll wear his Canada shirt, right? So we all want to belong somewhere, okay, to a tribe, and the unwritten rules dictate a lot of these things. Okay, so the Jewish men from the nation of Israel decided they were not going to take up arms. Guess what happened 20 years later? Their tribal chakra, the Jewish population in Israel, has the highest amount of prostate cancer than anywhere in the world. Why? Because the prostate sits in the first chakra, or the tribal chakra. That energy, that intention of not taking up arms, is causing the tribe to suffer. And that intellectual thought process has created disease. That's pretty amazing. So Carolyn Meese observed that. She's what's called a medical intuitive. So intention without action is useless, but let me tell you, intention with the improper action can be harmful, as she demonstrated. All right, so let's go through some of these things. So the first thing is, okay, number one, get your stress system and your brain evaluated. So here's one of the ways we do that. So remember, we talked about the immobilization. You become frozen. Your conscious mind takes over. Then you're going to decide, okay, I'm going to go into fight or flight. Okay, and then finally you say, that was too close for comfort. Okay, now I can calm down and let's get back to normal, right? So, and one of the tests that we do, where we put the sensors, they look like big clothes pegs on your wrist. It gives us a pie chart that tells us which one of these 3 phases you're stuck in. And so there we go. Here's the result of someone. This number right here in the upper left corner is at 583. That number should be under 100. So this person is under a lot of stress. Well, where is their stress system? So we look at the 3 pieces of the pie. So basically tonight we're all doing nothing compared to hard physical labor, right? So those 3 pieces of that pie should be about the same size. So where's the problem? Well, it looks like that red one is the biggest piece of the pie. So where is their nervous system stuck in? They're stuck in immobilization. So their body can't move forward. Their intellect cannot move forward. Their health can't move forward. Their pains won't change. They're stuck. Their body is stuck on pause. Okay. So the yellow group in this pie chart is the fight or flight. So if you're stuck in fight or flight, this is the person that their motor's running all the time. They just can't get going. So here's what we typically see. We see most patients with, a very small green piece, and then the red or the yellow are just huge. Very rarely do we see anybody with, the green piece of the pie or the rest and, laid back kind of person being over 30%. So that one test gives us this information. The other thing it gives us information about your brain. So in 5 minutes, we get all this information. So in this portion here, the psycho-emotional state, we see the number on the upper left-hand corner is 22. That number should be 50 to 100. Okay, so that's not good. That's way too low. Then you see those 3 boxes. The BRNTOX tells us, is there any brain toxicity there? Well, this is a weird scale. It's kind of like pH. So it's not a 1-for-1. So basically it goes from 0 to -3. So this is minus 0.1. So that's a little bit below. That means, there's some toxicity in the brain. We want this to be in the green range. Higher would be better. Okay. And then finally, that bottom circle is called ICP. That's intracranial pressure. How much pressure is inside the head? And there's only 1 of 3 possibilities: normal, high, or low. In this subject, there's a high amount of pressure inside the head. Then those bar graphs you see there, those are BNT, stands for the brain neurotransmitter. So these are the hormones in the brain that we briefly talked about. And you can see that, oops, sorry, I'm too fast on the trigger, right? So we have 4 of them that are too low, 3 of them that are too low. 1 is borderline low, 1 is high, and 1's in the normal range. But see the third one down, that's the dopamine. Okay. And then the bottom one, the happy hormone's okay, but that dopamine is like, okay, that's low. That means this person's going to start to do addictive things to try and get through the day, get through the week, get through the family gathering or whatever it might be. So that one simple test. So that's why we do this test on every new patient. So if you haven't been into the office in a while, come on in. We'd be happy to do this. It's just going to take 5 minutes. We systematically redo this on patients, and we just sometimes just do it for the fun of it. Sometimes we'll do it on a patient, we'll treat them and then redo it again within 5 minutes to make sure they're starting to change right away. So it's a simple test. So come on in and let us do this for you. We'd be happy to do it. Okay, so now, how can you reduce stress and protect your brain? And there's several things we're going to go through here. So the first thing is ground zero. We got to decrease cortisol and lower stress, lower the incoming stress and lower your cortisol. So don't lose track of, that's our ultimate plan here. We're going to give you a multi-dimensional way to do this. Right. So the first thing is get adjusted regularly. It's like we have patients that come in once a week, some every couple of weeks, some once a month. And the patients say, well, do I have to come the rest of your life? And the answer is, well, you get your teeth cleaned once and then never get them cleaned again. It's like, okay, you got to take care of your teeth. Oh, by the way, you can replace all your teeth with false ones if something goes wrong. But you should get adjusted regularly. So here, I'm going to show you why. Right. So one spinal adjustment, this was a scientific study done in 2016. One adjustment improves the prefrontal cortex function of your brain, the part of our brain that separates us from the animal world. One adjustment, it makes that part of your brain work better. This is another study that showed MTBI stands for mild traumatic brain injury. This person had a mild traumatic brain injury. They responded with chiropractic care and acupuncture. They had 8 treatments in 2.5 weeks. This is an osteopathic study, 16-year-old female. She had 3 head injuries. She had weekly manipulation treatments, and she returned to normal activities in 3 weeks. Another mild traumatic brain injury. Oh, sorry, I went backwards. Okay, this one published in 2017. This is in the Journal of Medical Acupuncture. They had cranial sacral therapy. So that's where you see Dr. Chip or myself pushing on your tailbone or pushing on different parts of your head as you're breathing in or breathing out. Some visceral manipulation. So you've seen us do that, probably have done it on a few of you, where we're working the abdominal contents, pushing on them, testing muscles and seeing if they're positioned properly. Some neural therapy. Okay, so that's where we put the brain tap unit on, or we do full neurofeedback on you. So they had improvements in pain. The ARM is active range of movements, their memory, and their sleep. This was another study. 73% of athletes returned to play after head trauma in 8 weeks when they received cervical spine manipulation and vestibular therapy. So it decreased the amount of time it took them to get better and back to playing their sport. Cranial manipulation enhanced restoration of cranial and extracranial somatic dysfunction and assessing and managing concussion. They got better when you did passive mobilization of the bones of the head. Okay, now this is one of my favorite ones. Spinal manipulation is indicated in stroke patients where they have muscle dysfunction. They found that a series of adjustments to the neck, there was a 93.1% increase in strength in their upper extremity and a 69.6% increase in the strength of their lower extremity. Okay, so let me get this straight. Person's had a stroke, their brain's been damaged, and by adjusting them, they still get better in their upper extremity and lower extremity? Answer is yes. So here's the question you should be asking yourself. I don't have a stroke, but will adjusting my neck make my brain, make my arms and legs work better? And the answer is yes, yes, yes. Okay, second group of things. You see us using cold lasers in the clinic all the time. This has been referred to as PFM for pure freaking magic, because a lot of wonderful things happen. I'm going to just give you a couple little studies here. LLLT means low-level laser therapy. So low-level laser therapy and vitamin B5 reverses those reactive oxygen species, the stuff that makes metal turn rusty or puts holes in our brain. Sorry. Boy, I'm really trigger happy now. And I'm going way the wrong direction. Okay, there we go. Okay, so laser therapy and vitamin P5P, basically vitamin 5, stops that cell death, that suicide, helps retain memory, and helps learning activities and protects the hippocampus. Here's another laser study, improved nerve function. It decreased the size of the brain lesion, or what they call white matter inflammation. It reduced the neuroinflammation and stimulates the formation of new neurons. You want to make new brain cells, you need to get some cold laser, and it's got to be the red colored one. 4 hours after an injury, if you receive laser therapy, it enhances the energy production of the brain, or ATP, and it decreases the inflammation in the brain. Low-level laser therapy twice a day significantly increased the energy of the brain, decreased that cell death, that suicide thing, reduced that reactive oxygen species and the reactive nitrogen species. That's pretty powerful stuff. So I know those of you that have been in the clinic, you see a lot of our patients, we're literally shining the laser on their head. This is why we do that. This is a little bit more for doctors, but specifically the red laser. Why we use the red laser, that's 635 nanometers wavelength. That's the frequency of the red color coming out of the beam. That inhibits the cytokine storm, those reactive oxygen species, and decreases inflammation. And then finally, reverses that reactive oxygen species, apoptosis, retains memory, helps learning activities, and protects the hippocampus where new brain cells are formed. Okay, that was the same one. I just changed the color, sorry. Okay, targeting inflammation in mild traumatic brain injury may prevent nerve degeneration and later dementia. Okay, let me get this straight. If you had head trauma and you have inflammation and you do laser therapy, it's going to prevent nerve degeneration and later dementia. Excellent. Well, what happens if you don't have head trauma and you have brain inflammation? Are you going to get nerve degeneration and later dementia? And the answer is a high probability you will. So maybe you should consider getting some cold laser on your head to decrease the inflammation, to get rid of the nerve degeneration, and just stop that path of heading down the dementia, Alzheimer's progression. Acupuncture will help. So again, you see a lot of our patients where we do acupuncture, sometimes on the head, sometimes on the body, sometimes both. Okay, here's a couple of studies. If you needle the suture of the skull within 4 days of head trauma, once a day for 10 days, you get a rapid decrease in that interleukin 6, which is the biggest fire hose, if you will. It's going to be like throwing gasoline on the fire. So acupuncture within 4 days of head trauma, once a day for 10 days, dramatically increases the bad guy and improves nerve function. Cranial acupuncture, so acupuncture on the head, will decrease that interleukin 6 and improves nerve function if you've had an acute cerebral hemorrhage. That means if you've had a brain bleed or a partial stroke, cranial acupuncture can decrease the inflammatory hormones and improve central nervous system function. Sometimes you see us put needles in the leg. So these two acupuncture points, their designated names are Tsusan Li. So stomach 36, stomach 37, 20 minutes twice a day decreases inflammation and reduces all those harmful chemicals that are part of that cytokine storm. That's pretty powerful. Okay, one more here. Laser acupuncture helps the cerebellum, or our balance mechanism. So lasering this acupuncture point right here, heart 7, HT7, decreases those reactive oxygen species, that inflammatory chemical interleukin 6, and then the GABA activity, and actually increases the density of cells in our cerebellum, or the balance apparatus of our brain. Okay, we're getting in the home stretch here. We have a hyperbaric chamber in our office, so this works really well. But you see a lot of patients walk around with cannulas, and they carry those little portable oxygen tanks. Why do they do that? Well, there's several reasons why. Okay, so oxygen under pressure forces more oxygen into the tissues and encourages new blood vessels to grow. So it's called the Douglas law. So a gas under pressure in liquid absorbs more gas, right? So your bloodstream is liquid. So we're going to add a little bit of oxygen with the oxygen mask and the oxygen concentrator, and then in the chamber, a little bit of pressure causes the bloodstream to absorb the oxygen faster, so you get oxygen to all your body faster. And remember, when you're at rest doing nothing, as we are right now, how much oxygen does your brain use? Altogether, 20%. That's right. So if 20% of your body can get more oxygen by taking a little bit of oxygen, would that be a good thing? And the answer is heck yes. So hyperbaric oxygen increases tissue oxygen, decreases inflammation, and has an antioxidant effect. Okay, so here's a functional MRI. So on the left, on the right is after the hyperbaric treatment. So the red and yellow areas is where there is the most brain activity. The dark blue is where and black is where there's the least amount of activity in the brain. So you can see dramatically different from left side to right side. And that's just after a 1 hour treatment of hyperbaric oxygen therapy, the amount of electrical activity that is improved in brain function. So this is why the athletes like to use it on their day off. This is why I like to use it after I travel or heavy exercise. This is also great for head trauma patients and also post-stroke patients. It works really well. Should a person who doesn't have any of that stuff get hyperbaric oxygen therapy? And the answer is it's going to only help your brain. So if you want to help your brain, this would be dramatic. And we have a lot of patients do that. We have a husband and wife that come down from Nebraska. We've been taking care of them probably for 30 years. They both can go in the chamber. Our chamber will fit 2 people. So once a month they come down and they go in the chamber, and then they get the regular treatment too. So it's pretty fun when they come down. Okay, short study. Hyperbaric oxygen significantly increases cerebral angiogenesis, the formation of new blood cells in your brain. You can make new blood cells in your brain by getting oxygen. White and gray matter improves, memory, executive functions improve, information processing speed improves, and your global cognitive scores can improve. Here's another one, helping concussion, significant improvements in symptoms, abnormal physical findings, cognitive tests, and they were able to return to play faster. So you see in the background, that's that study that we first quoted that showed the improvement in that. The SPEC is the name of that special MRI where the colors show up as opposed to everything being in black and white. Okay, so the next thing is you need to do some brain-specific exercises. Remember, we want to raise that brain-derived neurotrophic factor. So if you don't know what that is and you have a trainer, you need to ask your trainer, can you give me some BDNTF exercises, brain-derived neurotrophic exercises? If he doesn't know what that is, then you can use the following verbs. Can you help me do some high-intensity interval training? If your trainer doesn't know what that is either, let me suggest to you, you probably need to find another trainer. So it has to be a specific kind of exercise. Dr. Chip or Dr. I would be happy to help you with that, but we can cheat. This is why we introduced the bands in our last webinar. Those bands dramatically change the way you exercise. So in 20 minutes a day, you can do specific exercises that will force your brain to make that beneficial chemical that will make your brain decrease inflammation. It will protect your brain, and it will also improve your brain function. So they've got a great program. We're going to send you a link to try them. They're awesome. I know some of you on the call, like Bridget, she loves her bands, and they are wonderful. I love my bands. I did a workout today about an hour before I came on this call to get my exercise in for the day, and they're awesome. So you can cheat. You can be time efficient. You can be stress efficient by doing this. But again, if you've got a personal trainer, ask them, can they do brain-derived neurotrophic exercises or high intensity interval training? If they don't know what those are, let me suggest you probably need to find a different trainer. Okay, so the next thing is some brain-specific cognitive exercises. You need to do something to make your brain work more. If you don't do this, guess what's going to happen? Your arm muscles will shrink. You have to do something to your arms to make them stay the way they are or improve a little bit. Your brain's the same way too. So what are some brain-specific cognitive exercises? Well, the 2 easiest ones are learning to play an instrument. Now, piano is a good instrument. Drums would be the best. Why drums? Well, I'll tell you why not drums. They're awful noisy and it could drive you crazy. But drums are the best because you do something with each hand differently and something with each foot differently. So you get 4 different motions going on with different parts of your body that will stimulate your brain unbelievably. A next great choice is a piano or a keyboard instrument while your 2 hands are doing 2 different things. So you got to use both sides of your brain, got to execute 2 different things independently. Having said that, I play the saxophone. I use 2 hands to play 1 note, but it's, if you did an instrument like that or a trumpet that only has 3 keys, any of those instruments are great. But again, drums and piano utilize more aspects of the brain. Something else that's awesome is learning a new language. So there's a whole list. We're going to send you that list of things. The first one on there that helps about a language is it boosts your brain power. So, when my mentor, Dr. Yanni, was in the office, every time he came in or I went by him, he asked me to tell him something new in Chinese. So he forced me to, Japanese. He forced me to do some stuff in Japanese every time we met. So that's why I can speak enough Japanese to be dangerous. But when I speak it, I speak perfectly like Nihongo ga skoshi wakarimasu ka. And so that simply means, please forgive me, but I don't speak Japanese very well. So there's a whole host of other things that help you improve. But that first one right there, it boosts your brain power. So if there's a language that you've wanted to study all the time, like now's the time to start doing it. And there's lots of programs out there that'll help you do that. Your brain will be the benefactor of that. So brain specific cognitive exercises. Okay, so now the next thing is you got to balance your brain waves. Your brain waves are electrical things, so you sometimes need to do electrical things to do it. We talked about during the trauma webinar about using brain tap. So this is a wonderful procedure. You can, and we'll talk about a free application that they have, a free trial, but it balances your 5 different brain waves. And so is a home treatment to balance brain waves. And now we have the device you see there, we have that in the office. If you want to come to the office and try that, it's not necessary. Just a regular set of headphones will work. And then all you need is your cell phone or iPad that you can download the app to. It works really great. They have a 15-day free trial. We have some patients that wanted to buy the brain tap head device because it does have lights, colored lights in the eyes and colored lights in the ears. So if you just use your regular headphones or earbuds, you'll just get the sound, only different sounds in each ears. But with that device, you get laser beams coming in your ears and laser beams in your eyes. Now you got to close your eyes when you do it, but you can do it up to 2 times a day. We highly recommend this for patients who've been in a concussion, but it also helps develop your brain power and calm your brain down. So if you just take your phone and you scan your phone, like take a picture of that QR code right there, it'll take you to the center of this page that gives you that 15-day free trial of that app. All you have to do is give them your name and your email. You don't have to give your credit card or anything like that. And then after a few days, you'll figure out, okay, yeah, this is pretty cool. So we have a lot of patients that have done that. You can use it up to, if I'm not mistaken, 5 times a day. So this is something that you should seriously look at least take the free trial, because it'll help balance your brain rate. So oftentimes I do this at lunchtime. I'm probably going to do it after this webinar. I'm going to do it just to calm down right after, along with some eye stressed out. Okay, so there are some brain specific nutrients you should use. And there are 3 major things right here. So the eye stressed out helps lower the cortisol. That SERA-NAC or the SERA-NAC, the SA stands for succinic acid. So that SERA-NAC, that gets rid of those free radical oxygen species, the bad guys that go through the blood-brain barrier. Okay, but it also makes glutathione, which is an enzyme that helps repair damaged tissues. And then the last one on the right, the SERA-RENEW, that's a product that helps give you all the raw materials to help your brain work better. So we have a lot of patients that are on all 3 of those things. They work really well. If they have a tremendous amount of inflammation, sometimes they need a little I6 factor as well. So those 3 products work really well at decreasing the stress, repairing the damage, and then improving brain function. So those work really well. So give Sandy a call if you would like to try those, or come in and let us test your stress system. That would be a better way to do it. Okay, and our last topic is sleep. You need to sleep 8 to 10 hours. And as Dr. Chip has found out, this is really hard with a new baby. And those of us that have had kids, it's hard to remember what those younger days were like with the kids until Dr. Chip says, oh gosh, I went home and then, I took the baby so Christina could have a nap. And then the baby had to feed. So Christina had to get up. I had to have a nap. And so all of a sudden, oh yeah, I remember those days. So if you can't, here's what happens. If you get 6 hours or less, every hour you get less than 8 to 10 hours, you get a 30% decrease in cognitive function in the first 3 or 4 days. So if you have one night of only 6 hours sleep, you have a decreased cognitive function of 30% over the next 3 or 4 days. So now if you're consistently getting less and less and less, and you're averaging 4 to 5 hours a night, like I know some people are, it's like your cognitive capabilities decrease dramatically. And then guess what? Then cortisol ramps up because you're tired and you can't think straight, but you got to get through the day and you got to this meeting and that meeting and whatever it might be. And then so the cortisol keeps going up, that further causes problems with the brain. Okay. So here's the way you can cheat. So one of my mentors, when I was first in practice, so this would be 1978, he said, he says, young man, he says, and this was before cell phones, fax machines, internet, all the stuff that we take for granted every day now. He says, you need to take a break every day at lunchtime. And he says, don't return any messages, don't do any reports, don't read any x-rays, just take 30 minutes and do nothing. He says, now, you don't have to meditate. That would be better if you could, but just do nothing. If you doze off, that's okay too, but set a timer, because if you go too long, then you'll be tired because you didn't sleep enough. And so I was a young kid. I didn't know any better. I said, okay, I admire this doctor. He's pretty successful. His patients love him. He's really good. If I had something wrong, I'd certainly go to him. It's like, okay, I think I'm going to do that. And you know what? 40 some odd years later, I do that. And I've trained my body at it so long that I don't even have to set the alarm. I know at 1:42, my body wakes up no matter when I lay down. So if I lay down at 1 o'clock or put my feet up or whatever position I get into, at 1:42, I wake up and then the alarm goes off at 1:43. If I lay down and calm down at 1:30, at 1:42, I wake up. So because I've done it for so long, I've got my system trained that, okay, calm down quickly, but at 1:42, you got to wake up. And so that's pretty curious, kind of watching myself. Like I'll be laying there and I'll say, I think it's 1:42. I'll open my eyes and then the darn thing will go off. So, but that's what happens, that recaptures some of that rest. So 8 to 10 hours may not always be possible, especially when you're on vacation, having fun, if you're going to go on vacation now, or you're traveling. So the way you can catch up is a little cat nap. And Dr. Chip and Christine are finding out now it works pretty good. Now they're probably having more than one a day. But it'll change. Baby Evan will coach him up on his patterns, and they'll get used to his patterns. So sleep is really, really important. Okay, so now remember all the stuff we've blown through. You send the word stressed brain to 22454. We're going to send you a list of things, and probably by tomorrow morning I'll have a 1-page reference with everything on there, and then you'll be able to access all that stuff. So Scott, have we got any questions?
No questions. If you guys have any questions though, would like to ask, now's the time to do that. One of the great things is you really have a really clear style, Dr. M, and the visuals do help so much. So everything makes a lot of sense. But by all means, folks, if you have any questions at all, feel free to ask. Now's the time to do that. What is the Concussion Protocol for the BrainTap app? Okay.
So the Concussion Protocol, now we're working with them to develop something a little more specific. But if this is someone who has what they call their power user group, which is part of the subscription, then you want to go to the first thing we would do immediately after the concussion would be something called the Neuro-Infinity SMR protocol, which basically just calms the brain down generally. It's not very specific. And then according to the test we showed you and some of the other brain tests we do, then we might specifically go into doing a theta and a beta brain wave balancing. In other words, raise those part of the brain waves that are being suppressed. But we would start with that SMR protocol. So if you're one of those power subscribers to that BrainTap, that would be the first thing, the SMR protocol, then the theta beta. And we'd be happy to walk you through that. If you got your app in front of you, we'll pull ours up and we can say, okay, do this exercise, do that exercise, especially if it's someone who's had head trauma, and they don't live in the Kansas City area, they live far away. They have users all across the planet on those programs. So we're trying to get them to mold the program specifically. Okay, here's 10 things you need to do if you've got a concussion. That stuff is kind of there, but you just have to navigate through to get it.
Okay, great. She says that was Jody Bowman. Thank you.
Okay, hi Jody. That's our pineapple drinker.
Give us the number again for stress brain. Could you back up to that slide to text to?
Oh, okay, yes. All right, so you're gonna, all one word, stressed brain.
Mm-hmm.
Text that to 22454.
Yeah, and your phone may try to autocorrect that and put a space between stressed and brain. Well, a lot of the text services we use, they won't recognize it unless it's one word. So make sure that your autocorrect doesn't separate those two words.
And then one of the things we're going to have to do, I just got a notice today as I was programming some of the things to send you, the service we use to do this by June 1st, those digits like that are not going to change. It's going to end up being a toll-free number. So down the road, Scott, we're going to have to just change this, and I'll do a voiceover on the recording.
Yeah.
We can change that. But for now, until June 1st, we can use code.
Yeah, all the stuff we're using on our end too, same thing, short codes, they call them. They're going away. Going away.
Well, they don't have a way to tax them. I think that's the problem.
Yeah, that's right. Probably so. Excellent presentation, Mike Horenza says. Yes, very much. Excellent presentation. Anything else, gang? We're going to be wrapping it up here shortly.
Scott, hang on a second here. I think I got someone sent me a text message.
While you're getting that, Jody says, I learned so much today. Thank you. Bridget says, thank you.
Okay. Dr. Chip just sent me a note. It says the link to the brain tap is off. So we'll make sure we send you that from the SMS text where you'll be able to get right to it. So for example, if you try to picture the QR code we had up on the screen, I'll just flip back to that if somebody wants to try it real quick.
Well, in the chat box, there's a link that Dr. Chip dropped that does go to the 15-day free trial.
I guess he didn't need a nap.
Yeah. So if you guys will look in the chat and scroll up to Dr. Chip's link, it should be hyperlinked. You just click on it.
Okay, perfect.
Yeah. Yeah, there's a hyperlink. He dropped another one, so you can click that one.
Okay, perfect.
Okay, if everybody will click that and go ahead and do that now, because that will disappear when we end. So go ahead and click on that now. It should open a browser for you. Okay. We did broadcast live to Facebook. So what that means is within a few minutes of ending this, you could go directly to the Mladenoff Clinic Facebook page and see the video in its entirety.
Awesome.
Pretty nice. However, we do post this on YouTube. We also post it again, usually organically on the Facebook page, and we'll send you an email with those links and any supportive materials that Dr. M has mentioned tonight and that he's put together. And so I can't remember, Dr. M, did you say the PowerPoint slides will be available or?
Okay, so let me just go backwards here real quick. Yeah, there's too many PowerPoint slides. It's too big of a file.
Sure.
For example, when like all those slides, it'll be way too much, but there's, of course, I'm not going fast enough now.
That's okay.
The one where we went through the 12 different steps where brain stress makes the brain go crazy.
Yeah, hit escape and it should give you the list of them in the left-hand column that you can scroll through the.
There we go. Thank you.
Yeah, no problem.
Okay, so this diagram right here.
Right.
What I'm going to do is I'm going to send that diagram, and for each one of these, circles, I've got text description that I went through. So that'll be like one article, but it's about 4 or 5 pages long. So they'll get that whole article of stuff. So all the pictures that showed up like that, they're going to get all that information instead of the slide where it's going to, you have to put, there's like 128 slides. If you print 6 pages to a slide, that's still, 15 pages.
Right.
And they're going to be awful little small things too. So it's easier to just send them the links and then they can look at the whole article.
Okay. Absolutely. We'll do it. We'll get you everything you need. That's fantastic. Okay. Any more questions, folks? Going once, going twice. Okay. That's a wrap. We're super excited everybody came. Hope you got a lot out of it. And we look forward to sending you this information by email. In the meantime, if you haven't been in the office for a while and gotten your adjustments, follow his advice and go make that happen. Dr. M, thank you again for your expertise.
Thank you, Scott. This is so awesome. I'm so glad all of you were able to join us, taking time out of your busy schedule. And I know sometimes it gets a little crazy in the office, so that's why we like to do this. So come on by, get a Zinc taste test done, test out those BrainTap fancy headphones, get the stress test done on you. And if there's anything else we can do to help, that was the other thing. Just give Sandy a call if you want to reserve one of those room air purifiers to get rid of viruses and bacteria. Just let us know how we can help. We'll be happy to help any way we can.
Love it. All right. Everybody have a great night. Thank you so much.
Thank you, Scott. Appreciate it.
All right. Bye-bye.